Hello everyone. Today from Star Hospitals in the program of Let's Talk Health, we will be talking about a common condition which affects most of the common public. By the way, I am Dr. Shashikant. I am a senior consultant orthopedic surgeon working at Star Hospitals. And today in this program, where we are going to discuss about aspects of joint pains in general public, we have with us Dr. Madhuri, who is a colleague of mine and a senior consultant rheumatologist at Star Hospitals. Today, both of us together will go through some common questions which the public has with regards to joint pains and try to answer most of the questions with good answers. Good afternoon, ma'am.
Hey.
So, going back into the subject, arthritis is a common topic, and most of the public who come into our outpatient departments, either your or mine orthopedic department, usually have joint pains.
Correct.
So, as an orthopedic surgeon, I'm usually perplexed with as to when a patient should see a rheumatologist and when a patient should see an orthopedic surgeon. So, at the end of the program, if you are able to give a clarity to the public, I think it will answer most of the questions.
Correct.
Before going into the further questions, can you just explain what a rheumatologist actually means to the public?
Sure. So, this is a new field, relatively new field. There are not too many rheumatologists around. And rheumatology is a branch or a subspecialty of medicine. We are basically general physicians who have undergone further training in this subject of rheumatology. Rheumatology covers all autoimmune conditions. So, autoimmunity is where the body's immune system, which is normally supposed to defend us, for whatever reasons, it misfires and acts in a haphazard way and ends up damaging our own organs or our own body parts, which should be actually protected by our immune system. So, this phenomena is called as autoimmunity. And these group of diseases, there are more than 100 rheumatological conditions, and these group of diseases, commonly also known as connective tissue disease, are dealt by a rheumatologist. Now, because rheumatology is not one organ system, because the immune system can hit any part, commonly you see that the skin and the joints are affected by these autoimmune conditions. Here starts the confusion that which joint pain should be dealt by an orthopedician and which joint pain is to be dealt by or should be better approached by a rheumatologist. So, I think this background is where we should start off with. And why don't we just start off with saying straightforward, fracture, go to orthopedician. A rheumatologist has no role at all in management of any fractures. Okay. So, any trauma, if you have a definite trauma which has led to a bony pain or swelling and inability to use that part of the body or loss of function, then it is definitely traumatic in origin, and all traumatic cases are dealt by our orthopedician colleagues. So, we do not do any surgical procedures, knee replacements and all, if there is a joint which, in spite of medical management, has been damaged so far that medically no more further improvement can be expected with medications. Then in that case, we do refer to our orthopedician colleagues to consider either a knee replacement or hip replacement as the joint may be. But in otherwise cases in which you do not have a real reason where the joint pain is or why the joint pain has begun, you are getting up in the morning with stiffness, when after a period of rest, you are noticing pain, stiffness, swelling in your joints. It is associated with other things like low-grade fever, and sometimes you are having other organ system involvement also, like some skin involvement, extreme hair loss, oral ulcers, some other cardiac issues, lung issues, blood counts falling low, kidney issues, basically multi-system. Here it indicates that there is some systematic, that is something involving the whole body. And one possibility in these conditions could be a rheumatological condition. So, if you have multiple joint pains, and which with no history of trauma, if you do not have any known reason why your pain is starting, and if you are having involvement of multiple organ systems or many unexplained symptoms simultaneously, then yes, please see a general physician first, and if after evaluation a rheumatological condition is considered possible, you will be referred to a rheumatologist. Why don't we talk about how we differently approach a patient of joint pain? So, to our orthopedician colleague, I would say, how would sir approach, say, a 60-year-old lady who has come with bad knee pain of 10 years duration and now suddenly worsening over the last 6 months?
Yeah, the age group of 60 years is something which we commonly see in an outpatient department, and at 60 years, the most common consideration will be for osteoarthritis, which is an age-related problem. And at 60 years, obviously, she must have done some physical activity which has aggravated the arthritis. That is the reason she complained of pain. So we usually assess them clinically and take a detailed history, as you mentioned. And clinical examination usually shows that there is some joint line tenderness and then restriction of movement when we examine. Then we evaluate them with an X-ray, a standard X-ray, asking them to take an X-ray with them weight bearing.
Correct.
That is very important because one important factor when we are determining whether the patient needs surgery or not is the severity of arthritis. How bad is the arthritis? Because finally that is what matters to me. So if somebody has very severe arthritis, then he will be a candidate for surgery. He won't be affected or probably improved by any medical management. So for me to assess the degree of arthritis, obviously what are the symptoms that the patient is having, that is important. And at the same time, an X-ray is very important. So most of the times X-rays are taken with them lying down, which don't give a right picture. So one important information to everybody out there is basically take X-rays only with the patient standing so that it gives a severity of the arthritis. And based on the severity of arthritis, if it's mild to moderate, we still go for medical management. And if it's severe arthritis, we go for surgical management. And obviously, if it's a single joint involvement, this is the situation. But obviously, if she has multiple joint involvements, then the patient will probably land up with you.
True. So, one common question which I would request her to answer is, how long or what is the success rate of a knee replacement surgery? And a follow-up question, when would I require a revision or what is the average duration of surgery?
Okay. I mean, knee arthritis, obviously, as you said, the reason or probably the indication for knee replacement is basically pain. So it doesn't depend on the age of the patient. I mean, people usually talk about 80 years old or people talk about 20 years old. We do operations for all age groups, provided the arthritis is bad and it is interfering with their quality of life. So age is not a criteria. Even young patients can have a replacement or even older people can have a replacement. But replacement is only the end choice. That is the basic message we want to convey. That replacement is not to be done for mild to moderate cases, only for severe arthritis. And knee replacement as such is a very successful operation when done at the right time on a right patient by a right person who has got good training in knee replacement. And severe arthritis is the only indication. And as you said, with regards to the life of the knee replacement, most of the knee replacement which we do usually have an average of about 20 to 25 years. And that also depends on how the person or the patient uses the knee replacement.
Correct.
That is the reason we try and avoid knee replacement for younger people.
Right.
Because the more the people are on the knee and using it, the earlier the plastic will wear off and they will need a revision knee replacement. But yeah, as the second part of your question, if somebody has a revision knee replacement, let's say because the knee replacement is worn out, let's say after 20 or 25 years, the success rate of a revision knee replacement is not as good as a primary knee replacement, but it definitely works for some more years. Another 10-15 years, it will definitely work. Because once we do a revision knee replacement, along with removing all the old worn out knee replacement, we usually have to take out some of the bone as well. So the bone quality also deteriorate. So the life of it is not as good as the primary one, but definitely it will run as long as needed for about 10-15 years, equally good. And yeah, coming to your point about arthritis, which we were going back to medical management, you mentioned about rheumatoid arthritis. Is that the common rheumatological condition you deal with? Or what are the other rheumatological conditions or other conditions causing arthritis? Because ఇప్పుడు తెలుగులో మాట్లాడితే మనం యూజువల్గా కీళ్ళవాతం అంటాం. విల్ జస్ట్ గో టు తెలుగు. సో కీళ్ళవాతం అంటాం. సో నార్మల్గా పీపుల్ ఏంటంటే కీళ్ళవాతంతో బాధపడుతున్నాం. కీళ్ళవాతం అంటే మల్టిపుల్ జాయింట్ పెయిన్స్. సో అట్లాంటి కండిషన్లో అపార్ట్ ఫ్రమ్ రుమటాయిడ్ ఆర్థరైటిస్ ఇంకా ఏ కండిషన్స్లో కూడా పేషెంట్కి మల్టిపుల్ జాయింట్ పెయిన్స్ రావచ్చు?
సో కీలవాతం అనేది ఆరిజిన్ ఒకసారి ఫస్ట్ డిస్కస్ చేద్దాం. వాతం అంటే ఇట్ ఇండికేట్స్ గ్యాస్ ఆర్ ఎక్సెస్ విండ్ ఇన్ ద బాడీ. సో దిస్ వాతం అనే పదం ఇట్ కమ్స్ ఫ్రమ్ ఆయుర్వేద. సో వేర్ దే సే వాత పిత్త, దట్ కాన్సెప్ట్, దట్ ఇంబ్యాలెన్స్ ఆఫ్ యువర్ బాడీ కాంపోజిషన్. సో ఎప్పుడైతే వాతం ఎక్కువ ఉందో దే సే దట్ డెవలప్స్ రుమటాయిడ్ ఆర్థరైటిస్. సో దట్ ఈస్ వేర్ వి టాక్ అబౌట్ కీలవాతం. సో కీలవాతం అనేది ఒక్క వ్యాధికి సంబంధించింది కాదు. దేర్ ఆర్ మెనీ టైప్స్, చాలా రకాలు ఉన్నాయి. అందులో అట్లీస్ట్ 2-5% ఆఫ్ ద పాపులేషన్ ఇస్ ఎఫెక్టెడ్ విత్ రుమటాయిడ్ ఆర్థరైటిస్. సో రుమటాయిడ్ ఆర్థరైటిస్ ఇస్ డెఫినెట్లీ ద మోస్ట్ కామన్ రుమటలాజికల్ కండిషన్ వి సీ. బట్ అపార్ట్ ఫ్రమ్ దట్, వెన్ సమ్వన్ సేస్ అంటే నాకు కీలవాతం ఉంది ఆర్ కీలవాతంతో బాధపడుతున్నానంటే అది డైరెక్ట్ ట్రాన్స్లేషన్ టు రుమటాయిడ్ ఆర్థరైటిస్ కాకపోవచ్చు. ఇట్ కుడ్ బి లూపస్. లూపస్ ఇస్ అ డిజీజ్ ఆఫ్ యంగ్ ఫీమేల్స్ which can also cause multiple other organ systems involvement. Typically, lupus, the word comes from the word, lupus refers to a wolf. So, systemic lupus erythematosus. So lupus refers to the rash which is seen in these ladies over the over the nose and the cheeks, which gives the shape of a wolf-like appearance to the lady, which is a erythematous or a red photosensitive rash, where on exposure to the sun, the skin gets badly inflamed and is red, itchy and painful. So this lupus is another common condition. The rash is diagnostic of lupus. You have other conditions like systemic sclerosis, where there is a lot of skin involvement along with joint pains. These people tend to have some lung involvement and muscle involvement, a lot of gastrointestinal issues associated. You have diseases like Sjogren's syndrome, where dryness of the eyes, mouth and entire body is a major complaint, again more common in females. You have some conditions, although rheumatological conditions are more common in females, there is this group of conditions called as spondyloarthritis, which affects young males more commonly. In these, you have various subtypes, and again in this, the most common is a disease called as ankylosing spondylitis. Ankylosing spondylitis is a disease of young males between 20 to 40 years age group, and they complain typically of low back pain or alternating buttock pain. They wake up in the morning again with stiffness in the lower back, and this stiffness gets better with activity. This is again contradictory to your regular mechanical back pain, where they worsen after activity. So these stiffness and pains get better with activity, commonly involving the lower back, but again other joints also can be involved. They tend to have a family history. Sometimes these people have associated eye problems, associated psoriasis, a skin problem. Sometimes they may have some gastrointestinal issues. Gout, crystalline arthropathies, sarcoidosis, myositis, dermatomyositis. There are a whole lot of rheumatological conditions which fortunately are rare. So because these conditions, the thing is, they are chronic, and sometimes it is difficult to say how long do you require treatment.
One thing as a part of your investigation, ఒక పేషెంట్ మీ దగ్గరకు వచ్చిన తర్వాత యూ డూ బ్లడ్ టెస్ట్. సో మోస్ట్ కామన్ బ్లడ్ టెస్ట్ మేము కూడా యూజువల్గా చేసేది రుమటాయిడ్ ఫ్యాక్టర్. మోస్ట్ కామన్గా పేషెంట్స్ ఏంటంటే రుమటాయిడ్ ఫ్యాక్టర్ పాజిటివ్ వచ్చింది, నాకు రుమటాయిడ్ ఆర్థరైటిస్ ఉంది అని అనుకుంటుంటారు. సో ఇస్ దట్ ట్రూ? అంటే
నాట్ ఆల్వేస్
ట్రూ. సో అంటే రుమటాయిడ్ ఫ్యాక్టర్
డయాగ్నోస్టిక్. సో ఈ రుమటాయిడ్ ఫ్యాక్టర్ అనేది ఇట్స్ వన్ ఆఫ్ ద మోస్ట్ కామన్లీ యూస్ టెస్ట్ బై పీపుల్ హూ ఆర్ లుకింగ్ అట్ పేషెంట్స్ విత్ ఆర్థరైటిస్. సో ఈ రుమటాయిడ్ ఫ్యాక్టర్ అనేది వేర్ ఆర్ యూ గెటింగ్ ఇట్ డన్ అంటే మీరు ఏ మెథడ్లో టెస్ట్ చేయించుకుంటున్నారు. యూ హ్యావ్ వేరియస్ మెథడ్స్ ఆఫ్ డూయింగ్ ద టెస్ట్. లేటెక్స్, యూ హ్యావ్ నెఫ్లోమెట్రీ, యూ హ్యావ్ ఇమ్యూనోటర్బిడోమెట్రీ, and you have ELISA methods. Now of all these, the best method is the ELISA test. So if you are getting a test done, ఒకటి వేర్ ఎక్కడ చేయించుకుంటున్నారు, ఎలా చేయించుకుంటున్నారు, and the value. If you are for a lab cutoff of say 10, you have a value of 11 or 12, it may not mean anything. But if your value is 100 for a lab cutoff of 10, yes, it is time to look into it in detail. ఇది కాకుండా పేషెంట్స్ విత్ రుమటాయిడ్ ఆర్థరైటిస్ ఇట్ సెల్ఫ్ 80% ఆర్ రుమటాయిడ్ ఫ్యాక్టర్ పాజిటివ్. యూ డూ హ్యావ్ అ సిగ్నిఫికెంట్ 20% సబ్సెట్ ఆఫ్ పీపుల్ వాళ్ళ కీళ్ళ నొప్పులు ఉన్నాయి బట్ బ్లడ్ టెస్ట్లో బయటపడట్లేదు. దెన్ వీ గో ఫర్ అదర్ టెస్ట్. ద అదర్ రెలవెంట్ టెస్ట్ ఇస్ యాంటీ-CCP. అగైన్ విచ్ మెథడ్, వేర్, హౌ, వెన్, వాట్ ఈస్ ద వాల్యూ, సేమ్ డిస్కషన్. దెన్ నెక్స్ట్ థింగ్, వెన్ డూ యూ హ్యావ్ అ రుమటాయిడ్ ఫ్యాక్టర్ పాజిటివ్ బట్ ఇట్ ఈస్ నాట్ రుమటాయిడ్ ఆర్థరైటిస్. India, tuberculosis is a very common condition. Tuberculosis can sometimes lead to joint pains. Even in tuberculosis, you may have a rheumatoid factor positivity. So, in rheumatology, it is important first detailed history, examination, and then you go for the blood test.
Okay, so blood test rheumatoid arthritis positive వచ్చినంత మాత్రం rheumatoid arthritis
కన్ఫర్మ్ కాదు.
ఓకే, ఇప్పుడు మీరు ఇవాల్యుయేట్ చేసిన పేషెంట్స్కి రుమటాయిడ్ ఆర్థరైటిస్ పాజిటివ్ వచ్చింది, మిగతా టెస్టులు కూడా పాజిటివ్ వచ్చి యూ హ్యావ్ స్టార్టెడ్ ట్రీట్మెంట్ ఆన్ రుమటాయిడ్ ఆర్థరైటిస్. ఇప్పుడు రుమటాయిడ్ ఆర్థరైటిస్ ట్రీట్మెంట్లో ఇప్పుడు బేసిక్గా మీరు వాడే ట్రీట్మెంట్ ఏంటి అంటే దాంట్లో లేటెస్ట్గా వాట్ ఆర్ ద డెవలప్మెంట్స్? అంటే ఇప్పుడు పీపుల్ టాక్ అబౌట్ బయోలాజికల్ అండ్ ఆల్ దోస్ థింగ్స్. సో అది ఎప్పుడు వాడాలి అంటే మామూలుగా రొటీన్గా ట్రీట్మెంట్ ఏం వాడతారు, బయోలాజికల్స్ అనేవి ఎప్పుడు వాడతారు, దాని గురించి కొద్దిగా డీటెయిల్స్గా.
సో రుమటాయిడ్ ఆర్థరైటిస్ అనే కీళ్ళ వ్యాధిలో బేసికల్లీ కీళ్ళలో ఇన్ఫ్లమేషన్ ఆర్ వాతం ఉంటుంది. సో ఇది తగ్గించడానికి మందులు వాడుతున్నాం. ఇమ్మీడియట్గా ఫాస్టెస్ట్ రెస్పాన్స్ మీకు ఇచ్చేది స్టెరాయిడ్స్. బట్ దీస్ స్టెరాయిడ్స్ ఆర్ ద మోస్ట్ అబ్యూస్డ్ అండ్ మిస్యూస్డ్ డ్రగ్స్. వెన్ యూస్డ్ ఇన్ ద రైట్ డోసెస్ ఫార్ ద రైట్ డ్యూరేషన్, దే ఆర్ వండర్ఫుల్ మెడిసిన్స్. ద ప్రాబ్లమ్ విత్ స్టెరాయిడ్స్ కమ్ వెన్ ఇట్ ఈస్ excessive or inadequate or over usage and reckless usage of these drugs. So steroids, when used correctly, give excellent relief. ఇప్పుడు రుమటాలజీలో ఈవెన్ దో ద కాన్సెప్ట్ పీపుల్ జనరలీ ఫియర్ దట్ ఒకసారి మనం స్టెరాయిడ్స్ మొదలెడితే అది లైఫ్ లాంగ్ వాడాల్సి వస్తుందనే భయం చాలా కామన్గా వింటుంటాము. దట్ ఈస్ నాట్ ట్రూ. వీ ట్రై టు టేపర్ ఆఫ్ ద స్టెరాయిడ్ యాజ్ సూన్ యాజ్ యూ గెట్ బెటర్. Along with that, we also use some disease-modifying drugs, some drugs like methotrexate, leflunomide, sulfasalazine, hydroxychloroquine. And when even after using a combination of these drugs, you still, suppose the person still has joint pains and is not having relief of their symptoms, then we consider these injections called as biologics. So these biologics are among the latest developments, and biologics work in a more targeted way. They target certain chemicals or some chemokines in the body which are highly increased in the body in patients with arthritis. So these biologicals specifically go and inhibit the action of those molecules and thereby decrease the inflammation in the body. Again, these are powerful drugs and to be used under monitoring by a person who is experienced in using these medications only. And going one step further to Sir's discussion, if a person has had a damaged joint due to, in spite of or due to inadequate usage of these drugs, then we have to refer to an orthopedician who will assess the patient for a relevant joint replacement to help improve the quality of life.
థ్యాంక్ యూ డాక్టర్ మాధురి. సో ఈరోజు ప్రోగ్రాంలో ఆర్థరైటిస్ గురించి చాలా విషయాలు చెప్పారు. చాలా డౌట్స్ క్లారిఫై అయినాయి. యాజ్ అన్ ఆర్థోపెడిక్ సర్జన్ నాకు కూడా కొన్ని డౌట్స్ క్లారిఫై అయినాయి, బట్ ఐఎమ్ షూర్ జనరల్ పబ్లిక్ కూడా చాలా విషయాలు తెలిసినాయి. సో ఆర్థరైటిస్ అనేది కామన్ కండిషన్. చాలామందికి ఏదో ఒక ఏజ్లో జాయింట్ అరుగుదల, జాయింట్ పెయిన్ అనేది క్వైట్ కామన్. సో దానికి రకరకాల కారణాలు ఉంటాయి. సో ఆ కారణాలు మనం కరెక్ట్గా కనుక్కొని కరెక్ట్గా ట్రీట్మెంట్ తీసుకుంటే ఈ ఆర్థరైటిస్ అనే కండిషన్ని మనం నివారించవచ్చు, దాన్ని కంట్రోల్ చేయవచ్చు. సో ఫైనల్గా మనం తెలుసుకునేది ఏంటంటే ఈ కీళ్ళవాతం అనేది చాలా కాంప్లికేటెడ్ విషయం. సో దాన్ని నెగ్లెక్ట్ చేయొద్దు. సో సిమ్టమ్స్ వచ్చినప్పుడు సరైన డాక్టర్ని కలవాలి. సో థ్యాంక్ యూ డాక్టర్ Madhuri for your detailed evaluation. This is Let's Talk Health from Star Hospitals. This is the first episode where we have discussed about a common condition called arthritis, and we will continue the same program with a different condition. So please keep watching us. Thank you.